We are ready to consider Senate Bill 256, Senator Bidle, Maryland Energy Administration Resiliency Hub Grant Program and Fund. Nathan?
Senate Bill 256 establishes in statute a resiliency hub grant program that the Maryland Energy Administration would be required to develop resiliency hubs that provide electricity to low and moderate income households during an extended electric grid outage at no cost to the households. To provide grants under the program, the bill establishes the Resiliency Hub Grant Program Fund, which is funded in part by $500,000 annually from the Strategic Energy Investment Fund and by fines and penalties collected by the Public Service Commission. There's one amendment that's reflected in the reprint that's with you. Starting on page 7, the amendment reduces from 10 years to 5 years the length of time a resiliency hub project must commit to operate in order to qualify for a grant under the program. The amendment further requires a person who receives a grant to acquire a written attestation from all installation contractors and subcontractors, stating that the contractor or subcontractor will meet specified labor requirements, rather than, as introduced, requiring the person who receives the grant to attest on behalf of the contractors or subcontractors. On page 8, the amendment strikes requirements that the contractors and subcontractors attest to providing career advancement training and offer retirement benefits. And then finally on page 10, the amendment clarifies that MEA must designate at least $500,000 each year to the program.
All right. Is there a motion?
Favorable. Second.
Okay, any discussion on the motion? All right, if not, let's try to see if I'll ask first, if you're in favor, raise your hand. If it's unanimous, then we, all right. And it seems to be, thank you. Okay.
Next is Senate Bill 419, which relates to the opioid restitution fund and settlements related to the opioid pandemic. Senate Bill 419 requires that settlement funds received in accordance with the final distributor agreement as amended and the Janssen settlement agreement as amended be appropriated as agreed upon in the state subdivision agreement as amended. The Secretary of Health must establish and administer a grant program for the distribution of funds to political subdivisions of the state pursuant to the specified state subdivision agreement. The Attorney General must identify and designate the controlling version of any agreement or amendment. There are no amendments and there was no opposition at the committee hearing.
All right. Is there a motion? Senator?
I would like to move favorable, but I want to be amended to the bill.
All right.
I'll second the favorable.
All right, we've got a motion and a second, and with the request to add Senator Klossmeyer on as a sponsor.
Senator Bidle.
All right, Senator Bidle.
Thank you.
It's only
Senator Benson.
$400 million. You might want to jump on there.
Okay. Okay. All in favor, please raise your hand. Okay, that's unanimous. Okay.
The next bill is Senate Bill 590, which relates to the behavioral risk factor surveillance system. So a bit of information about the system is that it's an ongoing telephone-based chronic disease surveillance program designated to collect data on the behaviors and conditions that place adults in the state at risk for chronic disease, injuries, and preventable infectious diseases. So Senate Bill 590 would require the Department of Health, beginning in 2023 and every 3 years thereafter, in which the department conducts a survey as part of the behavioral risk factor surveillance system, to include the CDC module on adverse childhood experiences, or ACEs, in at least one version of the survey. So The CDC produces a core group of questions as well as different optional modules, and in this case, the ACEs module is one of them. MDH also advises that they use several versions of the survey, and so that each version is delivered to a certain subpopulation, and this would only affect one of those versions. Further, beginning in 2023, if MDH conducts a survey as part of BRFSS, MDH must conduct sampling for the survey in a manner designed to ensure that counties in which the population is at a statistically higher risk for adverse health outcomes to be oversampled. And if MDH includes a module on ACEs as part of the survey, MDH must post a state and county level data summary and trend report on all data related to ACEs or positive childhood experiences within 8 months after receiving the data from the CDC.
All right. All right, we've got a motion and a second. Any discussion on the motion? All right, all in favor, please raise your hand. Okay, that one's unanimous. Okay.
Okay, the next bill on the voting list today is Senate Bill 217. This is a departmental bill from the Commissioner of Financial Regulation, and this is the bill that regulates the charging of convenience fees on consumer loans for certain types of payments. And so I'm circulating a reprint. The Commissioner has been meeting with the Office of the Attorney General to work through some of the amendments, and this is the consensus product from those conversations. So I'll just run through the amendments really quickly, and then I'm available for questions, and I think the Commissioner is here as well. So what the bill does is it prohibits consumer lenders from requiring payment of convenience fees for payments made in the form of cash, check, money order, and then the amendments add to that an electronic funds transfer through the automated clearinghouse, the ACH payments. Lenders must accept a payment made by or on behalf of a borrower by check, money order, and an electronic funds transfer through the ACH. And there are some qualifications that a lender is, or some, I guess, exceptions. A lender is permitted to cease accepting payment by check or electronic funds transfer through the ACH after prior notice to the borrower if two payments made by check or ACH were dishonored in the previous 6-month period. But then the lender must accept subsequent payment by check or ACH if 3 regular payments are timely made by the borrower after that cessation of accepting payments in that means. I think this is maybe codifying the current practice.
Okay.
In addition, for other payment means, a lender may not require a borrower to pay directly or indirectly a fee for the transaction of a payment made by or on behalf of the borrower unless the amount of the fee is disclosed to the borrower at the time of the payment transaction, the borrower agrees to pay it, and the amount of the fee does not exceed either the actual cost charged to the person by the unaffiliated third party that is processing the payment transaction, or the average cost of the actual cost or the average cost of charges to the person by that third party. So in other words, they're only allowing the fee amount to cover the cost, the pass-through costs of processing the transaction.
But no third-party gouging.
Correct. And then finally, there's this provision in the bill that prohibits a lender from steering borrowers to forms of payment where fees may be charged. But there is an exception that a borrower may encourage payment in another form if it's going to prevent the borrower from incurring fees or charges for default or delinquency, having that result in a negative report to a consumer reporting agency or judgment against the borrower in a civil action or repossession of or foreclosure upon collateral. And then throughout the bill, there are numerous types of consumer loans that are regulated under the code. And so these same provisions are repeated in multiple sections of the statute. So if you get to the last page, the amendments authorize the commissioner to adopt regulations to implement the act, and then the effective date is pushed to January 1st, 2023.
All right. Senator Augustine.
Thank you, Madam Chair, and that's a lot, for sure. There was this letter, Patrick, that came from the OAG. Do these changes deal with significantly the concerns that are expressed in this letter?
So it's my understanding that the Attorney General's office supports the bill, or is removed its opposition to the bill as amended because of these changes. I think one, that the fees have to be disclosed, and it can't just be referenced in the loan agreement. And also, I think they were happy to see the inclusion of the ACH payments as ones that have to be, that can't be, for which a fee may not be charged.
Okay, thank you. I appreciate that.
Madam Chair,
Senator
I'm sorry.
Bellman.
Well, with that, I'm going to move favorable. The AG, as you said, did sign off on this, so I'm going to move favorable on that.
Can we get a second? Okay. Any discussion on the motion and seconded?
Thank you, Madam Chair.
Yes.
Did we address, I'm looking at the Maryland bankers, and Jason did
Pull your
oral.
mic down a little, yeah, towards you.
Sorry, thank you. Maryland bankers had oral testimony. Were we able to address their concerns?
So the bankers, it's my understanding that they were participants in this process that resulted in this set of amendments.
You can't talk. Put your thumb up.
Well, this was Jason, not.
No, you gotta get right, yeah.
I think I'm up.
I still can't help it. Okay, Senator Kramer and then Senator Hayes.
No, I'm good, Madam Chair.
Okay, you're good. Senator
Madam
Hayes.
Chair, I'm good on the bill. I'll vote for whatever, but like I have more of a process question. Like we keep getting handed these delineated versions like right before the vote and haven't really had a
Well,
chance to read it.
that's when
and
they can
digest
get it ready. It takes a lot of work to, and when
So
they
is
have.
that, I guess like the meeting has started. Everything is printed now, right? Can we just get whatever's on the agenda as opposed to like right before the vote, we get it, have to read it?
They are working right up to the last one. They literally are.
I get it, but they should have it printed by now, right? Anything else that's on the voting list, they should have those documents printed. I'm not talking about like in advance of this meeting. I'm just saying like we're here now.
Well, we want your attention on the one that's before us, and it's a different analyst working from time to time.
You know, I think, can I just say, I think generally speaking, and correct me if I'm wrong, the reprints are usually the bills where there's been some kind of consensus. I think like this example, we had the bankers, the AG, but it's a reasonable point. I'm just saying that generally the reprint issue is only when there's been like, there's no longer
you're
any
not getting them
opposition
all the
kind of
time.
situation.
Right, but nobody knows what
No, that's fair. I mean, I
right?
can't, I'm not gonna
Like,
push
we,
back.
we
on
have
that.
the hearings, like, weeks before, and then we come here, and there's, we may have made certain notes about a bill, and so we're asking if there's been an agreement, and there has, but we don't know because we're just reading it for the first time
Well,
and trying to follow the conversation.
literally, let me say this. They don't come here with a reprint for you unless some work group or the entities that were involved or that were arguing have reached some consensus that there's a plan to present to you.
The problem is, unless somebody agrees to share, all amendments are confidential until, they're distributed. And if we give them to you in advance, it's up to the, yeah.
I'm not saying in advance of the meeting. I'm saying we're here. We're in a voting session. You guys have them right there on your desk in front of you. Give us the amendment.
We want your attention, we want everybody's attention, though, on the bill that is in front of us. Some of us would be reading something else, and you'd find you'd voted in a manner that you didn't agree with later because you weren't paying attention to what's before it. Senator Reedy.
Madam Chair, I just want to maybe back up my friend here. If, in this case, I understand this is a consensus amendment, but sometimes we may not like the consensus. But, I mean, if we need to eventually do it where we're voting on a different day, I mean, we can do it. I just don't want us to rush through.
You get 30. I think what about if just at the beginning, before we even vote, like if you guys, I guess the point here is, if you guys have these reprints.
Senator Hershey's already confused.
Have these reprints, earlier in the day, during the hearings or whatever kind of thing.
What if you get it, you get the list the day before, you look at your list, and if you have questions about any of them, just come up and talk to the analyst.
Let me just tell you something. There isn't enough time in a 24-hour day to do the way that some of us are talking about. If you could see the work they're doing right up to the time they get to it. Okay.
I get what you're saying, I'm not sure if you understand my question. Literally, for
If
every.
they pass them all out, though, at once, some of us would find later we were sorry about the way we voted because we were reading another bill and not the one that we're considering at the moment. So they're giving you the materials, and we can all look at them together as we're hearing the analysts take us through what the changes are and the rationale and so on, and you're looking at that reprint.
We had a motion and a second. We just need to
Okay.
take a vote on this bill.
Okay. I think I moved favorable on the prior bill, so anybody wants to hold it? We can hold it, if somebody wants to hold it.
No, no.
Okay, so.
We need to take a vote.
We do need to take a vote, folks. So we have a motion, we have a second. Is there any discussion on the motion? Okay, if not,
17.
then all in favor, please raise your hand. If it's not unanimous, and it doesn't have to be, then we will do something else, okay? That one was unanimous, thank you.
And just to wrap that up, we will work to put an amendment packet together that can be distributed at the beginning of the voting session.
My only hesitation about that was always that, say we didn't get through the whole packet and then the amendments are already distributed. I mean, that's why we
Yeah,
try
it-
to do
it
it
didn't
one bill at a
convene.
time. But if you want, we will, if you think we're going to get through the entire list, then
Yeah, I just never experienced that before, where we didn't get through the whole voting list. Right? Have we, that's ever happened?
No, this is the way we've always voted.
Next bill.
Okay,
Moving to the next bill, the Senate Bill 253 increases the maximum amount of user fees that the Maryland Healthcare Commission may assess on hospitals, nursing homes, payers, and healthcare practitioners from 16 million to 20 million. And this bill was heard about 3 or 4 weeks ago.
I have a question. Tim, I know you have concerns about your hospital board. I mean, are you okay with it? I am, thank you.
okay. Are there any other questions? Do we have a motion? Okay.
Second.
Been moved and seconded. All in favor, please raise your hand. Okay. All right, it's not unanimous, so we will call the roll.
It's party vote. I mean,
Well, that's all right, we'll just call the roll.
Senate Bill 253, Senator Feldman. Aye. Senator Klausmeyer.
Yes.
Yes. Senator Benson. Yes. Yes. Senator Kramer. Yes. Yes. Senator Hayes.
Absolutely.
Yes. Senator Reedy.
Absolutely not,
No.
Okay.
Senator Augustine.
Yes.
Yes. Senator Beidle.
Yes.
Yes. Senator Hershey. No. Senator Jennings.
No.
No. Bill passes 8-3.
Okay, we're on the
Okay,
next.
Senate Bill 355 is a bill in which EHE is the primary committee and Finance is second on this bill. And so this bill is similar to one that we heard yesterday. It relates to pre-exposure prophylaxis and post-exposure prophylaxis treatment for HIV. These are the drugs that that can be taken to prevent infection or to address an exposure after the fact. And so the reason that EHE had this bill is because the first part of the bill authorizes a pharmacist to prescribe and dispense up to a 30-day supply of pre-exposure prophylaxis or PrEP if certain conditions are met. And so I can run through these very quickly.
Okay.
On page 3, some of those conditions are laid out, that there has to be a completion of a self-assessment. There needs to be a negative HIV test for the patient. The provision of counseling to the patient on ongoing use of PrEP. There's a requirement that a notice be provided to the patient that the individual be seen by a healthcare provider to receive subsequent prescriptions. There's some record-keeping requirements, a provision of notice to the patient's primary care provider about the encounter, and if the patient doesn't provide the name of a primary care provider, the pharmacist has to give a list of physicians, clinics, or other healthcare providers in the area, and this is an amendment that says including providers that receive funding from the Ryan White HIV/AIDS program. And this is a list of providers for them to contact regarding ongoing care for PrEP. There's some additional limits on the prescribing authority, and the patient, for example, the patient must submit evidence of a negative HIV test, and a required referral to a healthcare provider if a patient tests positive for HIV. On page 6 of the reprint, this is the provisions that deal with the pharmacist, the authority of a pharmacist to prescribe and dispense post-exposure prophylaxis under certain circumstances, and there are some similar requirements here as well. The pharmacist has to screen the patient and determine that the individual had an HIV exposure within the immediately preceding 72 hours, and this is because this type of treatment has to be provided within 72 hours of the infection for it to be effective. There's some a requirement that the pharmacist provide HIV testing or obtain the consent of the patient to submit to an HIV test. There's a counseling requirement on the use of PEP. There's some notice requirements to the patient about getting some follow-up from their primary care provider. And then there's a provision on page 7 here that allows the prescribing and dispensing of PEP if the patient refuses to get tested. There's a requirement that the pharmacist participate in a training program that's approved by the Board of Pharmacy before engaging in this prescribing and dispensing of PrEP and PEP. And the board has to consult with the pharmacy board has to consult with the Board of Physicians, the Board of Nursing, and other relevant stakeholders in developing the training program. The reason that this is in finance is because of the coverage provisions that start on page 7 at the bottom. First, the Medicaid program is required to cover PrEP and PEP. They currently do this. So currently, these two prescriptions are covered by the Medicaid program. And then there are some coverage requirements on health insurance carriers, and these coverage requirements are applicable to Medicaid managed care organizations as well. So if you go to page 9 of the reprint, there's a prohibition on a carrier applying a prior authorization or step therapy requirement on covering these medications. There's also a prohibition on applying a cost-sharing requirement for these medications. And in addition, the bill prohibits cost-sharing for related ancillary services for these prescriptions, such as HIV testing, kidney function testing, ongoing follow-up pregnancy testing, laboratory testing, some other things that are listed on page 10 of the reprint. And all these things I should note for the committee, from some new guidance that was issued over the summer, these coverage for ancillary services for these medications is required without cost sharing by the federal HHS and the U.S. Preventative Services Task Force for all plans that are subject to the Affordable Care Act, because they're recognized as preventive services that must be covered without a copay or a deductible.
Madam Chair, I'm going to move favorable.
All right, we got a motion and a second. Now, Senator Benson.
Yes. What was the position of the pharmacist regarding this bill?
So the Board of Pharmacy did raise some issues in their letter on the bill. I think they had some concerns about the Board of Pharmacy having to establish a training program for this. I think they also had some questions about the requirement that a provision in the bill that would allow a pharmacist to order an HIV test. They had some questions about some of the record-keeping requirements for a pharmacist to participate in this as well.
Yeah, this puts a lot of responsibility on the pharmacist. I would think that I'm just kind of concerned about their position relative to this bill here. I just think with the training and all the other things that are required of the pharmacist, I'm just very concerned about the responsibility that is being heaped on the pharmacist. That's what I'm worried about.
I would,
You could vote no.
I'm sorry?
You could vote no.
Yeah, but I agree. When you said that, how much training do they have to have?
So they would be required to undergo a training program that would be established by the Board of Pharmacy for this type of treatment.
Who's keeping the record?
oh, wait a minute now. Let's saw Senator Hayes next, and then I'll come back.
Yeah, no, I actually like the bill. I thought, Patrick, did you say, so one of the things what I like about finance versus HCL is we don't have scope of practice. So the reason why this was sent to EHE was for the scope of practice issue, whether or not it go to the pharmacist or the doctor, right?
That's correct.
What we're making a decision on is the business practices of it. EHE has already made a decision on the scope of practice issue. Is
Correct.
that what you're
So
saying?
exactly. So the reason that finance has jurisdiction over this bill as the secondary committee is because of the requirements in the bill relating to
business-
Medicaid coverage and health insurance coverage.
Right. And over time, like, I know there's always been hesitancy, and I'm so glad that EHE has scope of practice versus us, because sometimes it puts us as legislators in a referee position. But over time, there has been concerns about pharmacists having different responsibilities, but, you know, as they've gotten other responsibilities like vaccines and quick clinics and stuff like that, it's definitely proven to be more effective and quicker for people to have access to care, right?
Right.
All right, thank you.
Senator Hershey?
Yeah, thank you, Madam Chair. Just to follow up on Senator Benson, MedCai was against this as well, too. And again, I know this is scope of practice, but again, we still have to vote on the bill. And it had to do with, again, our pharmacists trained to be screening patients. Have they removed their unfavorable on this?
So MedCai submitted a letter of concern about the potential for having individuals diverted from care for ongoing HIV treatment and related to the prescribing of PrEP. Their opposition was not to the insurance coverage provisions of the bill.
No, I understand that part. Okay, but they still were opposed altogether. Yeah, thank you.
Okay. Senator Reedy, your hand up.
Some of the provisions of this bill, we can only affect the group market, right? We can't affect the individual market, or is this superseding all that?
So this bill can affect the small group and the individual market because these plans are in fact required under the Affordable Care Act to provide the type of coverage required here.
So we're just doing it in our state law?
Correct.
Okay. That's, whatever, that's fine, I won't hold it up, thanks.
Can we get a motion?
I moved already.
Oh, you already moved. All right, was the second? Okay. All right, all in favor, please raise your hand. Okay. Okay, all right. All right, well,
Did everybody except Benson?
did you, are you in favor or not? Okay, all right, so that's unanimous. Okay. Okay. Where are we now?
Senate Bill 531, this is the bill that requires the Maryland Health Care Commission to conduct a study regarding the quality of care provided by assisted living programs with 9 or fewer beds. Certain elements of the study include analyzing inspection data from OHCQ to determine on a systemic level where quality of care may be improved, examining the entry into and exit from the market for assisted living programs, considering the feasibility of developing a reporting system that protects patient confidentiality and makes data relating to catastrophic health emergencies declared by the governor and quality of care publicly available. There's also a requirement in the study to review the current assisted living program licensure regulations to determine whether these programs should be regulated differently than programs with 10 or more beds. The study would determine whether assisted living programs receive sufficient reimbursement to cover the cost of care for services provided. Also, whether the home and community-based options waiver or other waiver program that may be used for these programs can be revised to improve the quality of care and increase provider participation. And then finally, to review staffing resources that could be better utilized and made available for these programs.
Okay. What is your pleasure?
Second.
Okay, it's been moved and seconded. All in favor, please raise your hand. Okay, that's unanimous. Okay.
All right, we're, okay,
Oh, back to this one.
yes, Senate Bill 91. I have a copy of the reprint, but you've seen it several times. I didn't know if you wanted to see it again. Senator Beidle had a concern about, it was held again because Senator Beidle had a concern about the bed limit, but I think she's decided she's, well,
David, I decided I'm fine with it.
so I could remind you what the bill does, or again, okay, all right. It's favorable with amendments.
Okay. All right.
Senate Bill 91.
Okay. All in favor, please raise your hand. Okay, it doesn't appear to be unanimous, so let's call the roll.
Senate Bill 91, favorable with amendment. Senator Feldman? Aye. Senator Klausmeier?
Yes.
Yes. Senator Benson?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Hayes?
Yes.
Yes. Senator Reedy? No. Senator Augustine? Yes. Yes. Senator Beidle? Yes. Yes. Senator Hershey?
I'm no, but I just need to make sure I understand about the enforcement, so. No for now, and we'll see down the road.
No. Senator Jennings? No. No. Madam Chair?
Yes,
Yes.
okay,
8-3, the bill passes.
okay.
So the next bill on the list is,
Sorry for the late, I wanted to be a co-sponsor on 355, I apologize. That was the prep bill that Patrick had.
That's why we can't give you amendments ahead of time.
okay, so we ready for Senate Bill 255?
Yes,
Oh, yeah.
Okay, so the Senate Bill 255 concerns personnel in the Office of Public Defender. It does two things. It formalizes the employment categories of the current positions in the office by putting people in the appropriate service in the state personnel management system. That would be the executive service, management service, professional service, or skilled service. And it goes, after it does that, it would, and by putting these employees, particularly the assistant public defenders, into the professional service, it would make them merit employees and no longer at-will employees. Then it also adds that certain employees within the Office of the Public Defender would also be eligible for collective bargaining rights under Title III of the State Personnel and Pensions Article, and that would be the assistant public defenders and other personnel who are not in management within the Office of the Public Defender. You have two amendments in front of you. One is offered by Senator Kelly, and another one is offered by Senator Beidle. Senator Beidle's amendment is more technical, but if you decide you want to go with Senator Kelly's approach, then Senator Beidle's amendment will be moot. And I'll go through Senator Kelly's amendments first. Her amendments basically would just strike would leave the assistant public defenders as at-will employees and wouldn't change their status. It would formalize moving the other employees within the state personnel management system, which they already are in, and would formalize that they are merit employees. And it would also authorize these employees who are not attorneys within the office to participate in collective bargaining. They would be accreted to the appropriate bargaining unit by the State Labor Relations Board. So basically, the status of the assistant public defenders would not change under the amendments offered by Senator Kelly.
Move favorable on the bill without amendments.
okay, we got a motion and a second.
One amendment that we probably want to put on.
If you decide you do not want to discuss Senator Kelly's amendments and you just want to move the bill without amendments, then you really should adopt Senator Beidle's amendment because it was inadvertently struck that assistant public defenders.
I will withdraw my initial motion. Move favorable on the bill as amended with Senator Beidle's amendment.
And her amendment, under the current law, any attorney in the public defender's office cannot do any other kind of practice or private practice. That was struck for the assistant public defenders. This would restore that prohibition.
Okay, Senator Augustine?
Thank you, Madam Chair. Colleagues, this is obviously, I'm obviously a real strong supporter of collective bargaining and labor, without a doubt. But this is to me is a different situation. This whole system really requires reform. I'm talking about criminal justice. I'm talking about the courts. I'm talking about the prosecutors, and I'm talking about the defense. In the state of Maryland, we have the highest incarceration rate of African Americans. The numbers are outrageous, actually. When I'm looking at this legislation, and when I'm looking at the public defenders, I'm thinking about Curtis Brooks, actually. Because Curtis Brooks didn't have the type of defense,
That he needed.
and he spent a very, very long time in jail. And I am very, very concerned that the job of labor is to protect its members at all costs. And I'm a very strong supporter of labor. I really am. But if their job is to defend themselves at all costs, what happens when we have a public defender that's
But doesn't
not
do their job.
doing their job of protecting these people's lives, their freedom, for goodness sake? And the failures have been so stark in the state of Maryland that I am deeply troubled and deeply concerned that when we provide this additional layer, potential additional layer of protection, inability
You're
to
gonna have
get
more.
people who aren't doing the right thing out of there, it needs to be reformed. I am so deeply concerned about that I think this is really a very bad idea. These folks have portable skills. They are attorneys. I'm supportive all the way around for everybody else in the office, because as you all know in here, I'm a very strong supporter of labor. I really am. Well, I am.
You have expressed my position exactly.
But this right here is Curtis Brooks. This right here is protecting the folks when they don't get the type of service from the public defender that they so desperately need. That's why I'm not going to vote for this.
Are you talking?
Yes, I am.
Yeah. you-
Senator Benson?
All right, Senator Hayes.
Yeah, no, I agree with my colleague that, our criminal justice system is broken. And it's been broken for a long time. I think over the last couple of years, we've tried to make as many strides, about fixing it, and we still have a long way to go. I don't think this bill is about that, though. I think this bill is about, having employees of an agency have their due process in the personnel system, right? There's other things that we should know. We know that African Americans disproportionately, based off of socioeconomics, have a lesser shot of having true justice in what we call our criminal justice system. But that's not what this bill is about. This bill is really about individuals who work in a public defender's office having a right to bargain. So although I agree with some of the concerns of my colleagues, I think it's misplaced on this piece of legislation. This is really about giving employees in that office right protections. I work with state employees all the time. There's different levels of grievances that employees could go through. There's also a burden on the state or the employer to provide proof that employee hasn't been an effective employee to do it. But the larger issue around criminal justice reform is not what this bill is about.
Well, I think it inadvertently does make a difference, though, to have the people that you're dependent upon when you have the public defender's office doing it. And they are poor, they often can't afford any private counsel. If those people are going to be protected by the union, in every case, you're never going to get justice for a lot of people that are missing it now. I think it's going to be worse, and I'm sure that's not anybody's intention, but I think that's what absolutely will happen.
Madam Chair, are we talking about the bill itself, or are we talking about the amendment? The deputy public,
There's a motion for the bill favorable as amended by Senator Beidle, and it was seconded by Senator Hayes. That's what's on the table.
To be clear, Senator, the chair's amendment, which would have kept the public defenders out and allowed everybody else to get the collective bargaining, which I support, because I support labor,
Me too.
would not be the case with what they've put forward here. What they're saying here is that the public defenders would be included in this, the way that they've now presented it right now. That the folks who, again, have the lives of their people, of our people in their hands, right,
You're gonna protect them.
would not be, we would not be able to remove them, we could not be removed, okay, unless,
This is the birthplace of all that.
because they're going to be protected by the union, okay? So that's why I'm voting no on this.
Yes.
Thank you.
Senator Battle.
First off, it's not just the public defenders, it's the district attorneys, it's the judges. So I think that we're wrong to just blame public defenders. I think it's wrong that we're looking at dividing an administration by, we're going to allow part to be in collective bargaining and the other, and the public defenders not in collective bargaining. And I think they're not going to win every case. They're just not. It's you know, I know
We're not
you're,
suggesting that it will.
I know you're referring to one case, but they're not going to win every case. I think,
That was by way of example, Senator. That was an example.
well,
Okay. The AGs are not under collective bargaining.
no, they are not.
Okay.
Okay. All right, Senator Kramer and then Senator Benson.
Yeah, thank you for that, Madam Chair. And while I appreciate my good friend from Prince George's County's concerns, I would echo the comments of my friend from Baltimore City, who quite appropriately said, that's not this bill. And I think the notion that somehow, by bringing collective bargaining, is going to mean that we are locking in the worst personnel is A, absolutely unsubstantiated at all levels of private and public sector. I think that, in fact, we may find that by providing collective bargaining to those people who are stressed, overworked, underpaid, just might bring about the type of scheduling, the type of perhaps pay, the possible benefits to ensure that we are getting the very best that might be willing to fill these positions. And that's what this bill is about. I see the concerns about the criminal justice system. That's not this bill. So I would say that, again, it is totally undocumented that this would be a natural outcome of providing collective bargaining to these hardworking, deserving people. I, again, will push the motion favorable as amended by Senator Beidle, Madam Chair.
Okay, Senator Benson?
Yes, I just want to, when I signed on to this bill, it did not include, are you all trying to say to me that we want to include the deputy public defender, the district public defenders, and the assistant public defenders in this? Is that what you're saying?
No, the bill,
That's clarifying.
Mr.
the bill would establish that the assistant public defenders are going to be merit positions, and then as merit positions, they would also be moved into collective bargaining, and they would accrete to a specific bargaining unit as targeted by the bill.
Now, Senator Benson is looking at Senator Beidle's amendment.
Yes.
That's what she's seeking clarification
Okay,
on with regard to correcting.
Yeah,
as
that
you noted.
the Senator Beidle's amendment is corrective because the bill as drafted struck the prohibition for assistant public defenders to participate in private practice. So this would restore that prohibition. That's a corrective, I would call that a corrective amendment or a clarifying amendment.
Okay, walk me through, as a result of this bill, because I want to be sure now, because I heard what my colleague said, because I know about Curtis Brooks, I can tell you, 21 years incarcerated. I'm telling you, because he had a rotten attorney, but attorney who didn't care about my student. That's what I'm mad about. When I get mad, I'm telling you, I feel like throwing a chair. But walk me through who will get collective bargaining? Talk to me about who, in this bill, right now, who would be eligible for collective bargaining?
The bills, right now, the employees of the public defender are all special appointments. The assistant public defenders are special appointments in the state personnel management system. They're currently in the professional service, but they're listed as special appointments, which means they're at will. The other employees are already in the state personnel management system, but it's not specified by this legislation. So what the bill does is, first, it specifies that all the employees are either in the executive, management, skilled, or professional service within the state personnel management system. And then once you're in that specific service and you're specified, then you have, if you're in a professional or skilled service, you have merit protections. Then, as a result of that, then these employees are also added to the laws that give them collective bargaining rights. And that would only be the people in the professional service and the skilled service. And that professional service employees would include the assistant public defenders. The bill also specifies which bargaining units, after they're given that right, then the State Labor Relations Board would have the power to assign these people to certain bargaining units. The assistant public defenders would be assigned to a specific bargaining unit as called for by the law. And finally, the bill also would remove the prohibition that public defenders, under current laws, attorney generals, assistant attorney generals and assistant public defenders can't grieve under state grievance laws. This would remove that prohibition for public defenders, for assistant public defenders. So that's what the bill does.
David, I think to ask the question differently from, same question, but to Senator Benson's question, I think what she's trying to figure out, the bill that she co-sponsored, that hasn't changed on who's covered, right? We're not changing, like adding extra people that wasn't already in the bill that she co-sponsored. Right?
Yeah.
We're not doing.
The bill doesn't change, the bill
Right.
doesn't.
I think that's what Senator Benson was saying. Like, she want to make sure we didn't add extra people on top of what she agreed to.
I think she wasn't aware that the public defenders themselves were going to be in collective bargaining and protected in the way the bill does protect them. Yeah, okay. All right. Senator Augustine.
Thank you. Just to be very clear with it, I'm voting no because I think it is inappropriate for these attorneys
Me too.
to be in collective bargaining. Thank you.
Okay. Senator Kramer.
No, that's fine, Madam Chair. I just wanted to clarify if there was any doubt in anyone's minds on the committee. The bill simply provides collective bargaining opportunity to hardworking people that are in the office of the public defender. We heard from them testify at the hearing how overworked they are, that they reached out. They reached out and said, help us. They reached out to the folks who may or may not end up representing them and said, help us so that we can do our jobs the way we need to do them. And thank you, Madam Chair. We still have the motion on the floor.
Okay, let's move the bill. All in favor of the bill?
You should take a roll call.
Yeah, it's got to be a roll call. Okay.
Senate Bill 255, favorable with the technical amendment. Senator Feldman?
Aye.
Aye. Senator Klausmeyer?
Yes.
Yes. Senator Benson?
Pass.
Yes. Senator Kramer?
Pass.
Okay.
Senator Benson said pass. Senator Kramer?
Yes.
Yes. Senator Hayes?
Yes.
Yes. Senator Reedy?
No.
No. Senator Augustine?
No.
No. Senator Beidle?
Yes.
Yes. Senator Hershey? No. Senator Jennings? No. Senator Benson?
Yes.
Yes. Madam Chair?
No.
6 to 5, the bill passes.
So the next bill on your list is Senate Bill 380. This concerns EpiPens and the use of the storage, let's see, the obtaining, storage, and use of EpiPens at youth camps several years ago, maybe 5 years ago. You passed legislation to create this process for EpiPens at, there's an amendment, there's technical amendments which are also coming out of the House. You have the reprint in front of you. There was the Board of Nursing wanted a different description of nurse practitioner, because what the bill does is it allows nurse practitioners, including physicians. Yes, and then there's a technical amendment. There was the immunity clause for nurse practitioners was based on a pharmacist, not the doctors, so it makes the language identical that provides immunity to nurse practitioners as it is for physicians under the bill.
Okay, any discussion? Not, all in favor, raise your hand. Okay, that's unanimous.
And the last bill concerns is an add-on apparently to legislation that was passed last year. This deals with the development of a form by the Attorney General so they can provide information to people who might be about independent contractors working for residential service agencies. So last year, there was language in there that required them to report on personal care aides hourly rate and whether the residential service agency was classified or unclassified. That language was struck in last year's bill, and instead, there's a checkoff that they're working on right now. This bill initially restored those two provisions that were struck from last year's bill, plus 3 more. You have an amendment offered by the sponsor, which strikes the 3 additional provisions, and then requires a report be developed. And the testimony was that this report would be used if something is ever passed at the federal level, and if you wanted to access extra money, then you could, you'd have to provide information on independent contractors and residential service agencies. And this only applies to those who are getting Medicaid reimbursement for personal care.
Okay, Senator Hershey?
Madam Chair, just with these amendments, it's pretty extensive, amending one area and adding another, and I know that there's still been some difficulty of implementing what we had last year. Can we just hold this for a week until next week?
Okay, everybody gets one hold.
Oh, we need to move the,
Motion to allow the sponsors to withdraw the rest of the bill.
Except for the West. No, just kidding. No.
all in favor?
All right. Okay.